So first of all, what are the principles of therapy? The main principle is viral infections should not be treated with antibacterials. Sounds like common sense. There's one exception for this rule. If there is evidence of a secondary bacterial infection, that's when you will be treating that secondary bacterial infection. Can someone give me an instance where you would be treating a secondary bacterial infection? Exactly, Cameron. COVID pneumonia. If a patient develops pneumonia because of the SARS-CoV-2 virus, this can initially present as a viral pneumonia. A small proportion of these patients can develop a bacterial infection on top of their initial infection. And very good, you could have patients that have HIV, and because of the fact that they're immunocompromised, they can develop a bacterial infection on top of that on top of the HIV. Two, taking samples for microbiology culture and sensitivity testing is crucial. In terms of why do we take samples? Exactly, for targeted therapy. You want to know which organism is causing that infection. And then once you know which organism is causing the infection, you have an idea of what you should be using to treat it with sensitivity testing. So when you're taking samples, when should you take the sample? Should you take it after the first dose, second dose, before treatment? When is it crucial to be taking these samples? Before treatment. It's very crucial to be taking these samples before treatment, because once you start treating the patient, you're less likely to identify the causative organism. Generally, we prefer narrow spectrum over broad spectrum. What's the risk of overusing broad spectrum antibiotics? Resistance. So essentially, the more organisms you're covering, there's the greater the opportunity for organisms to identify that they're resistant to, either they can develop resistance or they can identify that they have some characteristic that means the antibiotic doesn't work against them. And then they have the opportunity and ability to pass that genetic information on to organisms within the same species and to other organisms in other species. So just covering more organisms than you need to increases the risk of resistant organisms that could cause more difficult to treat infections later down the line. And consider the patient factors when dosing the antibacterial. What patient factors would you want to consider? If the allergy status of the patient, of course, you don't want to give them something that can cause anaphylaxis in the worst case scenario. The renal function, possibly the hepatic function. Yes, thank you, Soha. Possibly the hepatic function would be useful. There's other aspects. The patient's age can determine which dose you'd be using. Yes, allergy status, recent antibiotic use, very crucial, as patients that have, in some cases, and we'll go through this later on, if a patient has, for example, received fluconazole for the treatment of invasive candidiasis, and you want to treat this patient again with another case of invasive candidiasis, that's when Candida albicans, for example, makes its way into the blood. You may not want to be using fluconazole again if the patient's unstable, because of the risk that it won't be effective because you've previously used it. The route of administration often depends on the severity of the infection. So can you give me an example where you use an antibiotic for cellulitis? There's a particular antibiotic, and the dose and the route will change depending on the severity of the infection. Do you know which antibiotic I'm talking about? Flucloxacillin. What's the highest dose that you can give intravenously? The highest dose that you can give intravenously is 2 grams 4 times a day. What's the highest dose that you can give orally? Yes, Tanisha. The highest dose that you can give orally is 1 gram 4 times a day. You can give a higher dose intravenously, and those with severe cellulitis can be given the dose intravenously. So in this case, the route of administration depends on the severity of the infection. You also, by bypassing metabolism from giving the patient the medication orally and giving it intravenously, you may have a much higher bioavailability, and you may have a much quicker onset of action. And duration of treatment depends on the nature of the infection and also the response to treatment. So you treat the patient for how long you know a patient should be treated for a particular infection. And then you look at that patient in particular and say, is this patient getting better after the 5-day course that we're treating this patient for a low severity community acquired pneumonia? Or does it look like they need a few more days? So you have to take both things into account, and it's a fine balance between the two.